Now to some health news, discussing all things COVID, and the pandemic began a little over 4 years ago, and that virus continues to mutate and spread around the world. Some aspects of COVID have changed and some have not. Dr. David Winter joins us to talk all about the current status of COVID. Dr. Winter, what are you seeing now with COVID infections?
Yeah, Tashara, some things have changed and some have not. What have changed is loss of taste and smell. We hardly ever see that anymore. The symptoms are about the same: head congestion, headache, sore throat, cough, body aches, fatigue. But those symptoms have changed, and they're usually much, much milder now. Thank goodness. For healthy people, much, much milder as a disease. We still have some serious illnesses. In fact, there's still been up to 10,000 deaths since the first of the year on COVID. Those are mainly in older folks, frail people, and folks with some kind of immunocompromised condition.
Have official recommendations at all regarding COVID changed?
They have in two ways. One, because the elderly and the frail and the immunocompromised people are more likely to get sick, the CDC is recommending they get a vaccine twice a year. For everybody else, it's once a year. The other thing that has changed is what we see with COVID right now is very, very mild, and it tends to go away very, very quickly. So that's a wonderful thing that we're seeing.
So what are, Dr. Winter, the current thoughts about long COVID? I know this was something that shocked a lot of people early on. What are some of those lingering symptoms?
Yeah, long COVID is a condition where the symptoms tend to last weeks, months, even years longer. The main symptoms that last a long time are this horrible fatigue, body aches, and then trouble thinking, concentrating, memory loss. We call that brain fog. The good news is that's much less than it was early on in the COVID pandemic. Maybe 6% of folks get that now. Most of those get better in a couple of months. Some last longer. About half of those last longer. Some good news about that, we found this antibiotic Paxlovid, or Paxlovid some people call that. If you take that in the first 5 days of having COVID, you're much less likely to get long COVID.
Okay, we talked about vaccines a little earlier, but I want to talk about those vaccines in relation to long COVID. Do they help prevent long COVID as well?
They do significantly. People that have been vaccinated are much less likely to get long COVID. They also have other long benefits. And, you know, even though right now COVID is mild, I want to compare this to influenza. About every 10 years, the flu is pretty bad. It was really bad in 2018, lots of deaths. Most of those folks had not been vaccinated. COVID has been mutating a lot this last year. 5 times all those mutations have been mild. So the symptoms are mild for most people, but I suspect it's going to be bad one day. Next month, maybe 5 years, 10 years, who knows? The folks that have been vaccinated are the ones who could be protected. So you might think about that. We protect ourselves from serious illness from the flu. You might want to do that from COVID also going forward.
All right, good stuff as always. Dr. David Winter, thank you so much for joining us.
Thank you, Tashara. Good to see you.